Nurse Paul, I'm concerned about Mr. George's condition. He's been admitted to the hospital for several days now.
Yes, Mihira. I've been monitoring his progress closely. His vital signs are stable, but he seems to be experiencing some discomfort.
Have you been able to communicate with him effectively?
It's been challenging. Mr. George has difficulty communicating due to his cognitive impairment.
That's understandable. We'll need to find alternative ways to assess his needs and ensure his comfort. Have you been able to involve his family in his care?
Yes, his family has been visiting regularly. They're very supportive and concerned about his well-being.
That's great. Family involvement can be crucial in providing emotional support and advocating for the patient's needs.
Mihira, I've been working closely with Mr. George's family to understand his preferences and ensure his care is aligned with his wishes. Mihira, I'm truly sorry to hear that the pain is still bothering you significantly. We absolutely want to ensure you're as comfortable as possible during your recovery. Managing your pain effectively is a top priority, and we have several strategies to help you with that. Firstly, we've prescribed specific medication for your pain, and it's incredibly important that you take it exactly as directed, even if you feel a little better, to keep the pain consistently under control. In addition to medication, applying ice packs to the injured area can really help reduce swelling and numb the pain. You can use a bag of frozen peas or a commercial ice pack wrapped in a thin towel, placing it on the cast for about 15 to 20 minutes at a time, several times a day. Also, leg elevation is one of the most effective non-pharmacological methods. Try to keep your leg above the level of your heart as much as possible, especially when resting. This significantly reduces swelling and discomfort. Beyond these, there are other strategies that can complement your pain relief. We encourage gentle toe movements. Wiggling your toes can help improve circulation and prevent stiffness, as long as it doesn't cause sharp pain. Additionally, practicing relaxation techniques like slow, deep breathing or guided imagery can sometimes help your mind manage the sensation of pain. How do these pain management options sound to you? Do you have any concerns about trying them?